chitosan, which is a biopolymer material. It's the second most abundant biopolymer on Earth, and it has a unique ability to be made with our process into a high-strength structure that can behave like a plastic, but is still susceptible to mild acidic solutions. We can use it in the body as a stent to hold something open, but then we can dissolve it away with an acid that's tissue-friendly or won't destroy or disrupt the rest of the environment. And that particular feature has a significant functional match to one of the most common medical implant used in children in the United States, and one of the top 5 surgeries, which is an ear tube surgery. 8% of kids have had ear tubes in the United States. In Europe, the numbers are just as strong. And these tubes are designed to sit in a child's eardrum who's experiencing chronic ear infections, the most common reason kids go to the doctor, and ventilate the middle ear space so that they experience less ear infections and you can deliver antibiotics locally instead of systemically. The reality is that these tubes don't always just naturally push out of the eardrum or just shut out marsupialized. And repeat surgeries are common. The American Academy of Pediatrics recommends that after a few years, these tubes are surgically removed if they're still persisting, because they can cause permanent holes in the eardrum. And the numbers are quite compelling. There's been a significant increase in the amount of tube insertions as we migrate away from systemic antibiotic use. Going from 500,000 to more than 1.5 million in the US alone. And unfortunately, with that comes increasing complications. And so by building a chitosan or biopolymer-based tube that works exactly like a standard tube, but instead, when it's time for that tube to come out, that patient has the opportunity to, instead of undergo a second surgery under general anesthesia, which for children carries a lot of risk. You can use otic drops and just dissolve it away. And what that looks like here this is some of our work in chinchilla proof of concept studies compared to a silicone tube that has to be pulled out of the eardrum, where you can see the hole that remains behind. Now, ear tubes have not been innovated on in almost 75 years. The same plastic and silicone tubes are being used. It's really been commoditized into the operating room procedure. And so we're facing a business challenge where we're upgrading the category of implants in a very high volume space. And we're going from a low cost passive implant to an outcomes driven implant with a controlled removal feature. And so that means that when we think about introducing this into the commercial market, we have to price against the cost of removal surgery, not the cost of a tube, but ensure that the payment for these ear tube surgeries, which are broadly covered, still allows for that increase in cost. And so we've had to hit that sweet spot where we've validated with surgeons and facilities that that's something that they're willing to take on, and we have had to quantify the value that this represents to a system and in terms of how this looks for an insurance company or an integrated system. Plus, we want to make sure that the barriers to adoption in terms of clinical pathway have been adequately refined and addressed, and that there's no barriers or changes for surgeons who will be the ones driving the use of this and the adoption pathway for commercialization during commercialization.